Organ donation is one of the most controversial topics in medicine today. From varying views on religious, ethical, and political beliefs, this video will analyze the topic of 3D printing from a scientific and ethical standpoint. Beginning with discussing current organ donation procedure transitioning into 3D printed biomaterials, there will be a compare and contrast between organ donation and 3D printed organ donation, discussing the advantages and disadvantages of each. Finally, the video will finish off by analyzing the future impacts of 3D printed organs. All previously mentioned concepts will be explained using a case study of a 24-year-old science teacher named Emily. Emily was relatively healthy until one day she was diagnosed with a chronic kidney disease. Unfortunately for Emily, her condition had her health quickly deteriorating and she fell into end-stage renal failure. Her doctors decided to put her on an organ transplant list in the hopes of getting her back to her previous self. Regardless of age, sex, or medical condition, anyone could be a potential donor, with factors such as blood types, potential infections, and survival benefits displaying the importance of having as many Canadians sign up to be as donors as possible. To donate their organs, a person must be a registered donor at their time of death. Registration can be done online at beadonor.ca or at a Service Ontario Centre. To register to be a donor in Ontario, you must have a valid Ontario health card and be over the age of 16. After the organ donation procedure, the transplant procedure begins. The directed transplant begins by finding a registered donor. The blood samples of the donor are tested after they're legally brain dead to ensure that the person is still a viable donor. The blood types of the donor and the recipients are then matched through a national transplant list. A standardized process is utilized to determine which recipient on the waiting list will acquire the donation of the organ. The donor is then taken to the operating room where the organs are surgically removed. The removed organs are then sent to the transplant hospitals where the recipient candidate is in the operating room waiting for the organs. However, in Emily's case, her doctors were unable to find an organ in time, so they decided it was time to start looking towards other solutions. After intensive research, they determined looking into bioprinting and determined that would be the best option for Emily. Similar to 3D printing, 3D bioprinting is a constantly evolving innovation. 3D bioprinting first needs to create a digital file or 3D model, which can be of any desired structure based on the CT and MRI scans. In order to create this model, specialized software is used, and the model is microscale involving a process that deposits material layer by layer. There are various methods of bioprinting. Inkjet bioprinting involves the principle behind inkjet bioprinting that is in inkjet regular printing. Laser-assisted consists of a layer of cell-laden bioink coated on the donor plate and a thin metal layer is coated on top of the bioink. Extrusion is when the researchers load cartridges with cell-laden bioink and insert them into one or multiple print heads. Finally, stereolithography occurs through exposing a light curable resin to a precisely patterned binary image by its source that creates a 3D structure. It is important to note that developing different types of 3D models requires different types of cells, bioinks, and equipment. After they're printed, the materials remain in a relatively sluggish state. Hence, an extra step is necessary to solidify and blend them properly, called cross-linking. Cross-linking can be achieved through different environmental controls such as temperature, UV light, and chemicals. Then the bioprinting cross-link structures need to go biologically to reproduce so that the cells will grow around the printed designs. This is known as incubation. It occurs within bioreactors that provide ideal conditions for tissue growth and reproduction, called the maturation period. Now let's compare organ donation and 3D printed organ donation. The advantages and limitations of both will be discussed. The positive aspects of organ donation include an increased lifespan and improved quality of life. It removes a candidate from the transplant list so that patients don't have to wait several years before receiving a transplant. Positive aspects of 3D printed organ donation includes alleviating the organ scarcity problem, reducing the risk of rejection after transplant, and replacing annual testing. And finally, it has a cost and time-effective method compared to traditional organ donation. The negative aspects of organ donation include all short and long-term risks that come with living with organ donation. These include surgical complications such as pain, infection, blood loss, and allergic reactions to anesthesia, as well as possible long-term complications such as wound infections and abdominal bleeding. Negative aspects of 3D printed organs include the potential emission of harmful chemicals in the process. Increased diversification of low-viscosity bioinks is necessary to enhance the efficiency of outputs in 3D bioprinting, which may not be available, hence a material unavailability. Lastly, there are bioethical and legal concerns around bioprinting revolving around feasibility and ethical implications of these technologies. Organ donation involving 3D printed organs has various beneficial aspects. As positive social and economic aspects, involves reducing healthcare costs and creating new job opportunities in biotechnology. There's a current debate about ethics behind traditional organ donation, and 3D printed organs might alleviate some of the varying ethical considerations. However, the main challenge with organ donation is organ scarcity, and 3D printed organs have the potential to solve this issue. Going back to Emily's case study, Emily's doctor successfully transplanted a 3D printed kidney, and she was back to her healthy self. Overall, 3D printing is enhancing global